motivated to keep on jumping. And motivation is key to all of this. So I'm glad that you all got motivated to come here today. And I'm so glad that Dr. Phil Schneider came up with today's title, Being Heard and Being Understood. It is really a miracle that out of all the millions of people in the world, no one person's voice is the same as another. We all have our own unique voice. And today we'll see that no matter where we are in our lives, we always have the choice to improve and change for the better. Putting these events together takes a lot of planning, and I want to thank our team behind the scenes and all of our advisors and our talented panelists today that help bring these programs to you. Now, our sponsors play a very big role in our events. We get ideas from them. We meet new experts in the field from them. We learn from them, and we're very grateful for their support. So to learn more about our sponsors and their medications and therapies, we've started a new Tuesday Talk series called the PWP Pipeline to Better Health and Understanding. It's so helpful for us to know as much as possible about what is available to help us maximize the quality of our lives. So I want you to please meet our very special sponsors. We're going to start with AbbVie. And I want you to see on each screen, there is a website which you can jot down and take a look at your own time. And I want to thank Scott from AbbVie. And you can learn about Duopa. You can learn about their medication at duopa.com. I want to thank Greg and Visca from Accorda. And you could read about Imbresia at their website, imbresia.com. I want to thank Marianne from Adamas, and I think Joe is here too. And you can check out their medication at gocovery.com. Boston Scientific is with us today. I want to thank Layla and Michael, and you could learn about dbsandme.com. Hugo Kieran, I want to thank Kimberly and Mike. We had our first PWP pipeline with them, and Dr. Rizak was the speaker. And I must say, it was very successful because after Dr. Rizak gave a terrific presentation, everyone got to talk and ask questions. And that's why these Tuesday talks are so important. And that's why it's important for us to learn from our sponsors. I want to thank Medtronic, Jenna Alley, who's always been there for us. And I also want to thank Allison and Bill at Supernus. You can learn about Zetago and Apokin. So again, thank you to all of you. I enjoy learning from all of you. Now, to begin our program, let me introduce you to Dr. Elizabeth Kira, a very busy neuropsychologist who always makes time for us. She's a board-certified clinical neuropsychologist and practices in the Department of Neuropsychology and Neuroscience Institute of Hackensack University Medical Center here in New Jersey. And she's the assistant professor of neurology at the Hackensack Meridian School of Medicine. She's also co-authored numerous publications. I am very grateful she is hosting today's program. Please welcome Dr. Elizabeth Kira.
Hi, everybody. Welcome today. I'm so happy to be here with you today, and I'm so glad to have been given the opportunity to participate in something this important. Before we get started on a little introduction on our topic and what we're going to be focusing on today, I do just want to make sure that everyone knows how to kind of manage their screens. So if you look at the top of your screen and just use your cursor to try and get to the top of your screen, you'll see some options come up. You'll start to see some of the different kind of icons that we have in the program. And to be able to see both the slides that we're working on as well as the speaker, we just want to walk you through some of the commands or maneuvers that you might have to do. So While you are on the screen, you'll notice that the slide right here next to the side tells you a little bit about how to get to side-by-side mode so that you can see the speaker and the slides. So while you're viewing your screen, you're going to go up to the top and click on View Options. Once you click on that, a drop-down menu will appear, and you should see an option at the very bottom that says side-by-side mode. Okay. Once you click that, you should be able to see the slide on the side and the speaker on the other side. You also have the ability to go up when you move your cursor and change it so that you're either seeing a gallery view or a speaker view. So if you go up with your cursor to the right of where you saw that view options, you have a speaker view, or you have a gallery view where you see all of us, the panelists today. The other thing you can do is make this two screens either bigger or larger. So if you hover your pointer towards the middle of the screen, you'll see between the slide and either the speaker or the panelist, depending on whether you have speaker or gallery view on, you'll see two little double lines. And if you hover your pointer above that, it will turn into kind of a gray line going up and down vertically on the screen, and you'll see two arrows. If you just click on that and you drag it either to the left or to the right, it'll make it so that you can adjust that side to whichever size you want it. So that's a little bit about how to manage the screen options today. Make it a little bit easier to listen and focus in on what we're doing. I want to talk to you a little bit about today's program. It's all about being heard and being understood. And why is that so important? We know that in Parkinson's disease, there are a variety of different things that can affect the individual's ability to be social. Um, from anything from the fact that with Parkinson's, sometimes we have an increase in what we call apathy, or just like a lack of energy, a lack of motivation to do things. Sometimes it's difficult because one of the symptoms is masked faces, so it's difficult to show your emotion, right? It's sometimes difficult because we feel like there are difficulties with walking, maybe our meds timing interferes with the activities that we want to do, and so we tend to stay home much more. Other times we might feel like we're having difficulties keeping up with the pace of information that's being presented to us. So there's a lot of different things that can affect this, but today's main focus is going to be talking about the communication portion of this and just how important it is to work on that. We want to be able to tell people, our friends, our family, new individuals that we meet, that we are the same person. Parkinson's doesn't have us. We happen to have it, but it doesn't have us. Okay. And so it's really important to let people know I am the same person. I enjoy the same things. I want to be a part of everyone's life in the same way. Um, and to do that, we want to make sure that we kind of try and maintain our best health. And there are a variety of different ways that we can do that. And again, today's talk will be focusing on communication and speech and language and how to be heard and be effective in being heard despite the challenges that might be thrown our way. But some other things that we may want to focus on are things like making sure that you accept your friends' invitations, just like you did before. Don't be scared. You might want to check out the venue and make sure that you have a safe way of getting there, getting to the restroom, taking your meds. You might want to see what the timing of the activity is so that it doesn't interfere with your medications. You might want to try new things, meet other people, whether it's with or without Parkinson's disease. There are lots of different social activities that individuals with Parkinson's disease can sign up for so that they have other individuals that have Parkinson's disease with them and they can kind of find some sort of support in that. But you can do many other things out in the community. It's so important that we do this because we know that that social support network, particularly in chronic neurologic conditions such as Parkinson's, we know that it can affect our disease outcome. And there is research that shows that the more engaged we are, the better we do. and the better we manage our symptoms. So you really want to make sure to stay as active as you can. I always say to people, you know, with COVID in particular, everybody's inside, everybody's isolated, and they say, you know, I don't know why, but I feel like I'm not as happy as I was before, or I don't feel as sharp as I was before, or I feel like there's a decline in my voice. Well, I know why. If you think about an athlete that hasn't worked out for 6 months, they're not going to be at the top of their game. They're not going to be in shape. They're not going to be in their best form. And this is really no different. People think it is because it's something more abstract. It's not as tangible or obvious or observable as a strong muscle would be on the arm, right? When you're lifting weights. But it is important to work out our brain and work out these functions. So please do your best to try and make sure that you're improving any sort of skills that we're working on today, but make sure that you're reaching out to your friends, that you're continuing to try and be active to exercise these things. So having said that, I am going to introduce our first speakers, Dr. Rizak and Dr. Fichetti. Dr. Michael Rizak is a board-certified neurologist, a researcher and professor with a master's in psychology and a PhD in brain anatomy. He currently serves as the director of movement disorders at Nuvance Health and Vassar Brothers Medical Center. Dr. Rizak was a distinguished physician endowed chair of the Parkinson's Disease Research Society, Northwestern Medicine West Region, before joining Nuvance. Dr. Rizak's broad research interests include medical and surgical treatments for Parkinson's disease, symptom management, and quality of life for Parkinson's patients. He's been working with deep brain stimulation applications and techniques and bioethics as a specialization. Dr. Robert Fichetti is a Phi Beta Kappa graduate of Johns Hopkins University. He received his medical degree from NYU School of Medicine in 2005. After his residency training at North Shore LIJ, he completed a 2-year movement disorders fellowship at Baylor College of Medicine. In addition to his peer-reviewed publications in neurology, Dr. Fichetti is a contributor to MedLink. Dr. Fichetti works in Hawthorne and specializes in neurology and psychiatry. He's affiliated with Westchester Medical Center. So why don't we go ahead and to the next screen. I'll leave it up to Dr. Rizak to introduce the biological basis and neurologic basis of voice issues in Parkinson's.
Okay, thank you. Thanks for everyone for being here and really taking some control of your Parkinson's disease. And you know, knowledge is power. We say that a lot, but it really is. Since I have a short time to talk about neurological basis of speech problems, I'll jump right in it, you know, and talk about the fact that there's about 10 million people with Parkinson's in the world. And the data suggests that about 80% of those people with Parkinson's will have difficulty with their speech at some point along the pathway of Parkinson's disease. And it's interesting that these speech problems are not mostly amenable to the usual drugs that we use for other parts of Parkinson's, like, you know, stiffness, slowness, tremor, things like that. I mean, sometimes the speech will respond a little bit, but it really requires a lot more than medications, and that is the speech therapy, which you'll talk about, and we'll hear Dr. Schneider talk about in a little while. It's interesting to know that there are a number of components that contribute to a person's speech. You know, like the forcefulness of the speech, how to take a breath. Those are all coming from the central nervous system. And we don't think about those usually, but when you have Parkinson's, we have to think about those things. So motor activity, forcefulness of speech, loudness, there's a sensory component. We need to get some feedback to ourselves, probably from hearing, that will tell us, are we speaking loud enough or not? But interestingly, there's a misperception of the loudness of our speech in usual conditions with Parkinson's. We also lose our internal cues for like, let's keep going with our speech and not have this, what they call festinating speech, where we stop speaking and then start again, and it's very jagged. And the other part of the speech problems has to do with psychology, the psychological conditions of the patient. Is it attitude? Is it vigilance? Are we really paying attention, or are there other things that we can do? Well, in the brain, this is a very complicated process. Speech is and language very complex. And when you have disorders of speech, there are numerous areas of the brain that are involved. The frontal lobes, the basal ganglia, I'm just going to name these, there will be a quiz later, and also the auditory areas and the cerebellum. And we know that those areas are not functioning well in patients with Parkinson's disease who have a speech difficulty. And some of this has been shown using functional MRI or PET scan. And you can look that up if you're interested, but I have a short period of time. Now, the other interesting thing is with speech therapy, looking at PET scans and functional MRIs pre and post therapy, there are huge differences that take place in the areas of the brain that are involved in speaking and improved speaking. And I think the last point will be that actually we go back to a more older, phylogenetically older system for emotions and speaking after the therapy. And we see that sometimes in people who can't walk and suddenly they're able to get up and run and save someone's life. Another pathway, an older pathway, may be activated. And it's the same thing. It seems in Parkinson's that we're activating an older system, but it does take the therapy and repeated practice. And I'm gonna stop here because I see I'm way over my time, but I'm gonna let Dr. Fricchetti take over at this point and talk about the types of voice problems that we encounter in Parkinson's.
All right, so thank you very much. So I hope you can hear me okay. So I think the main complaint that we have from patients is low voice volume or hypophonia, and later on we'll talk about some strategies to address that. But certainly that can make it very difficult.
I think we have a frozen Fricchetti, Dr. Fricchetti. Maybe you want to pick up Dr.
Sure.
Rizak?
Sure. Well, as Dr. Fricchetti was saying, and the sort of, we call it a hypokinetic dysarthria, speech issues really have consequences in our daily life. And the other interesting phenomenon about this is that the patient who has this are usually unaware that they're not speaking loud enough or clear enough. They just go to town, they just keep going. And it's usually spouses and children and others that inform the patient that, what do you say? I can't understand you. Usually the patient thinks that we all need hearing aids because we can't hear them, but because their perception of loudness is completely different than reality. And I think I mentioned this. This is some of the sensory feedback back into the brain, into the frontal lobes, the lateral frontal cortex, that helps make adjustments or scales the volume of our speech. And that is very disrupted in Parkinson's disease and can cause lots and lots of problems. Frustration for the patient, of course, sometimes even depression and isolation. And patients are left out of conversations because no one can hear what they're saying. So we have to fix that. And we have some things to talk about that might help that. So I think my time is up, or Dr. Fricchetti's time is up for this segment.
Yeah.
And,
All right, so let's get back in and we'll talk about the next
move on
segment.
to the third part because Dr. Rizak covered you on that second one. So let's move on to the third one.
So let's talk about the consequences. So one thing that patients talk about is that because of difficulty starting speech sometimes, and to me, I make that almost be similar to freezing of gait, that people might sort of be stuck and have difficulty starting. Same thing can happen also with speech. And oftentimes, patients with Parkinson's disease have had people fill in for them, just try to complete their sentences. And in the end, their voice or their idea is literally being lost. So to me, the delay in speech initiation has been something that I've observed where an entire idea or train of thought might be filled in by someone else. With the fast speech, again, to me as a physician, listening to fast speech both in the office and also on the phone, the tachythemia, which it's called, has been incredibly difficult to understand. And I think that can cause truly severe communication difficulties because the words are so bunched together. And later on, we'll also talk about some potential strategies for that as well. And for the low speech volume, again, it gets very difficult to have communications with people, especially if now we're also wearing masks and we're more distanced. So we can no longer come closer to someone and try to speak with them more clearly because we have to distance at 6 feet. So I think in today's era, the mask requirement and distancing requirement makes life very difficult in the setting of low voice volume. All right, so we could go to the next topic, please.
Yeah, I think for this segment, we're going to talk about working with a speech therapist. I think from movement disorders neurologists who are dealing with Parkinson patients with speech problems, we love speech pathologists, speech therapists. That is the key to success for our patients. I think, medicines just don't do it. Deep brain stimulators just don't do it, at least in my experience. And so I think it is repetition, practice, feedback that the speech pathologist gives patients that is really the key to success. And as I mentioned, some of the MRIs and functional MRIs and PET scans done after therapy have shown a whole reorganization of the speech pathways and network with patients doing much better as a result. And sometimes these are considered phylogenetically older pathways that get reactivated. Whatever works is important, I think, to keep going. And I don't know if Dr. Ficchetti, you have any other comments about our speech pathologists?
Right, so we will talk about various strategies to increase, for example, speech volume. And, the speech therapist will talk to us more about that. But I think that's a way to improve a symptom without using a medication, just by speaking differently, by looking at breathing out to increase voice volume. And to me, I'm happy that we're able to improve somebody's quality of life really without having to rely on.
Dr. Rizek, you could finish that sentence.
Well, I think the message is there from Dr. Ficchetti, but I think this takes the participation of the patient, the motivation to want to get better. And I've seen dramatic results with speech therapy, and I think we have to take advantage of the speech therapists that we have in our community who really have an interest in Parkinson's and other movement disorders. So I think I'll stop there.
Well,
Okay.
this was
I don't know if Dr. Ficchetti is back with us, but
right.
I think the point here is it's really important to have a diary, at least a record of the times when speech get bad, how they relate to time of day, how they relate to last medication that's been taken, and when is the next dose coming up? What kind of speech issues are you having? Are you at that time? And it can be multiple different kinds at different times of day. So low volume, poor articulation, speaking really fast with not really opening your mouth. Those are the things that would help the speech pathologist, speech therapist, and it would also help us. And what I said previously, I don't want to imply that medications may not help, but for patients who are taking the medicines, generally more medicine is not the answer. But there are people that are undertreated. We see patients in the office who come in and they're very undertreated in general. And we may get a response for speech as well. And I think later we're going to talk a little bit about the intertwining of speech and swallowing. Those functions kind of go together. And even in those brain imaging studies, it's been shown that those areas overlap, and people who do well with speech pathology training or speech therapy can have benefits for their swallowing problems, if they have swallowing problems, at least strengthening them. So I think here we're dealing with brain mechanisms of attention, sensory feedback, having a psychological condition. So if you're depressed, it's not going to be there. So there's multiple areas of the brain that are involved. Speech therapists are really good at sorting all those things out and are key to success. And I'll stop here.
So for the next section, what we're going to be talking about is being understood, patient terminology, things that may help you communicate better with your physician. It looks like Dr. Facchetti is here just in time to take that over. We're just getting started with being understood patient terminology.
All right, great. So I'm so happy that I got my internet back at this point. So I think being heard in the patient office is extremely important. I think I've had some miscommunications before, not because of a physical speech production issue, but because of terminology. And both in the office and also over the phone, people would tell me, well, my dad has more tremor, there's this bad movement. And then, being a physician, I asked them, well, what do you mean movement? Is it really a tremor, which is around the joint and it's repetitive, or is it more of a dance-like movement? And then I would ask, is it like, Michael J. Fox movements? And they would say, yes, it's exactly like what Michael J. Fox looked like on TV. And if I didn't go through that, I would have gone through the wrong thing. Dyskinesia means these movements that are very dance-like. And that happens usually when there's too much medication, especially too much dopamine, whereas tremor typically happens when the dopamine runs out. So I try to work with my patients on the vocabulary, such as tremor or dyskinesia, and then also on state, which is the regular, normal time when the medications are working, off state when the medicine stopped working and the tremor comes out, and then on state with dyskinesia, which is when these movements are present. So it's really important for us to realize that being heard in the office is not just being heard physically by fixing the low voice volume, but actually about using the correct vocabulary to discuss issues with your doctor. And the visits will be so much smoother when we don't have to, work as much on the terminology, and we can go straight into actually addressing the problem at hand by the patient and their caregivers being able to tell us exactly what's happening. So I ran a little bit over, but I think this was very important to mention. So let's move on to the next topic.
Okay. I guess, should I take that one, Dr.
Yeah.
Yes, it should. Dr. Rizak, if you could just tell us a little bit about the importance of being heard as a community member.
Okay. Well, I don't know if you've ever heard the phrase for humans really are creatures that long to belong. You know, we are part, we're social creatures, and we need to be close to people. And when it's okay, we need to touch people and hug them and things like that. But, you know, of course, with that, let's forget the pandemic, which is horrible. But with Parkinson's disease, people who cannot speak well or communicate, they get ignored. They're left on the sidelines. People don't engage. The Parkinson patient who has a dysarthria, no volume hypophonia, people don't listen because they're frustrated, and the patients are frustrated too because nobody hears, you know, what they're saying, and a lot of anger can build up within the patient, but that's another story. Right now, we're talking about community and trying to be part of the community. And as much as I'm not thrilled about the virtual community, it's kind of what we have. At least it's something. But I think a real community, whether it's a support group or going maybe and being spaced properly, or going to a lecture when we can do that, being spaced properly, and even our families when we can do that. It's very important for us to have that community, and we need to communicate. We also need to communicate to our community what we're feeling, what's going on with us, what kind of problems we're having, and we have to be understood. And again, I'm gonna put all the weight on Dr. Schneider to help us communicate properly with one another and bring that community sense back. That longing to belong is really part of our human nature. And I'll stop there.
Thank you. Go ahead.
Dr. Kira, we just got one chat saying that this is about being heard and being understood, and some people are having a hard time hearing us. So just let's make sure everybody is very focused on their mic and can speak a little bit louder.
Perfect. Thank you for that reminder. It's my pleasure to introduce our next speaker, Philip Hamilton. He is a musician and founder of Unlocking the Voice and master voice teacher for Dance for PD in Brooklyn. He is a Bessie Award-winning vocalist and composer with over 25 years of experience as a teacher, a touring musician, and producer. He's performed and recorded with a wide variety of artists and leads workshops for many of the world's leading institutions, including Lincoln Center, New York University, the Danish National School of Performing Arts, and Barnard College at Columbia University. Welcome, Philip.
Hi, how's everybody? You can hear me okay, everybody?
Yeah.
All right, good. All right, so how's everybody doing? My name's Philip Hamilton. As Dr. Kira just said, I've been working in the community for more than 10 years. I started off as a musician for dance for PD, and eventually we realized that there was a need for everyone and an interest for everyone to sing together, because there's a community. And there's something that happens when everybody sings together. You know how that is. Even just singing happy birthday, there's something that happens. So we started to work on this a little bit, and we've developed a program that we're very proud of. Now, one of the things that also happens is when you're singing, if you're singing a song from, you know how it is, when you're singing a song from back in the day or something that you remember, it brings out all of these feelings and these memories in you. So, if you're someone singing T for Two or Chattanooga Choo Choo, all of a sudden it stirs up memories. And I've seen in a lot of patients a remembrance, they connect with the words and they connect with the style and the time, and we're off to the races, which is pretty exciting. So the thing we're going to work on now is breath and building awareness. So stick with me, all right? Now we're going to what I'm going to ask everyone to do is just to work with me, okay? So right now, just everyone just kind of get your feet planted on the ground. Yeah, everyone's sitting nowadays, and just kind of loosen up a little bit. Yeah, this thing happening. Yeah, it's a little bit of breath awareness. So first, we're going to start off. Now I want everyone to just breathe through your nose, okay? Just breathe through your nose. And I want you to hold it. Breathe through your nose. Let it go. We're going to try it again. Breathe through your nose. Breathe in. And we're going to hold it, okay? Let it go. Now, this time we're going to breathe through our mouth, not the nose. Okay, breathe into your mouth. Yeah, a whole nother feeling, right? Let it go. Same thing. Breathe through your mouth. And yeah, hold it. Hold it. Let it go. Now this time you're gonna breathe through your nose with your mouth slightly open. Okay. Now try with me. 1, 2 on 4. 3, 4. You're gonna hold it. 1, 2, 3, 4. Let it go. 1, 2. We're gonna try that one more time. Breathe through your nose with your mouth slightly open. 1, 2. Yeah. 3, 4. Hold it. 1, 2, 3, 4. Let it go. 1, 2, 3, 4. Okay, so now we know it's probably to fill everything up. The best thing to do is breathe through your nose with your mouth slightly open. Yeah, feels good. Now we're gonna keep continuing. Now here's what I want you to do. Now think of Santa Claus. So ho ho ho. Okay, this is gonna be the center of your voice right now. So I want you to go ho ho ho. Okay, one more time and ho ho ho. Yeah, and last time ho ho ho. Now this time ho ho ha. Yeah. Remember, every time I ask you to breathe, it's through the nose with your mouth slightly open. Okay. Exhale, everybody. Exhale. Now breathe in. 1, 2 on 4, 3, and go ho ho ha and ho ho ha. Yeah. One more time. Breathe in. 1, 2, 3. Ho ho ha and ho ho ha. Yeah. Last time. Breathe in. 1, 2, 3. Ho ho ha and ho ho ha. Okay, so we got that. Now I want everyone to sort of reach in the lower back, right? You grab your lower back, yeah, and you'll see that there's and take this deep breath that we've been working with. Now try to breathe back into your lower back. Yeah, you feel that? There's pockets of air right there. Exhale and then breathe in again. This time through your lower back. Let go, let it go. One more time. Breathe in through your lower back. Okay, so now we got 3 things working. All right, we're breathing through our nose, the mouth slightly open. We got the ho ho ha 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 ha. We got the awareness of that, and now I want you to breathe into that lower back. Okay, now exhale, everybody. Okay, all right. Hold on one second. What we're gonna do is a bunch of breath exercises that are important to singing. Now what we're gonna try is this. We're gonna do a quick breath. So it's gonna go 1, 2, 3, 4. Okay, so your breath is going to be a quick breath. 1, okay? So exhale. Breathe in. 1, okay. Actually, hold on one second. Exhale again. 1. So we're going to quick breath on 1. 3, here we go. And breathe in. 1, 2, 3, 4. Quick breath. 1, 2, 2 more. 3, 4. And quick breath. 1, 2, 3. Just a quick breath. And 4. And 1, 2, 3, 4. Quick. Great. Now what we're going to do is a long breath. Okay. Obviously, if we in a class, we're going to take a lot more time with this, but I just want to get you up to speed. Okay. So this is the opposite. Now we're going to do a long breath. So it's going to be 1, 2, 3, 4. Ha. 2, 3, 4. Breathe in. 1. Yeah. Okay. So exhale, everybody. Ready? Get ready. Remember, the feet are still on the ground. Exhale. We're going to breathe in long breath. 1, 2, 3, 4. Give me 1. Ha. 2, 3, 4. Breathe in. 1, 2, 3, 4. Ha. 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 2. Yeah, we're taking all that in. Breathe in. 1, 2, 3, 4. And ha. Last 1, 2, 3, 4. Breathe in. 1, 2, ha. 3, 4. And go ha. 2, 3. Nice. Okay, we're gonna move on to the next section. And we're going to call that, we call that vocal articulations. Okay, we're going to try this. Everything that we learned, that we just learned, we're going to try here. Okay, we got that breath awareness. Now, this time we're going to add it to phrases that we know and love. Okay, we're going to start off with Peter Piper picked a peck of pickled peppers. Let's put that up there, Maurice. Okay. All right, so everyone, I want you to sort of to breathe in. Remember, through your nose with the mouth slightly open. Remember, we got the lower back. We got the ha, 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 ha. Yeah, we got all that going. Okay, so now take a deep breath. 1, 2, 3, 4. I'm just going to go ha, 2. Yeah, 3, 4. Breathe in. 1, 2. Now we're just going to go Peter Piper here. And Peter Piper picked a peck of pickled peppers. Breathe in. The peck of pickled peppers, Peter Piper picked. So you have a short time. Breathe. And if Peter Piper picked a peck of pickled peppers, breathe in. Where's the peck of pickled peppers Peter Piper picked? Yeah. So we're using all of this. We use everything we just talked about, the breath and awareness. We're going to try that one more time. Okay. Breathe in. And Peter Piper. And Peter Piper picked a peck of pickled peppers. Breathe. A peck of pickled peppers Peter Piper picked. Breathe, yeah? If Peter Piper picked a peck of pickled peppers, yeah, keep going. Where's the peck of pickled peppers Peter Piper picked? Okay, great job. We're gonna move on to the next one. If we can move it up, Maurice. All right, now this is something. This is a well-known vocal articulation that we do in theater and things of that. In you know, like before a show and to warm up. All right, so this is called "What a To Do to Die Today." If yeah, let's try this. Okay, so let's talk it through. And what a to do to die today at a minute or two to two. A thing distinctly hard to say, but harder still to do. For there'll be the tattoo at 20 to 2, a rather tattoo. Okay, yeah? And the dragon will come when he hears the drum at a minute or two to two today at a minute or two to two. Yeah, a little bit of vocal articulation, a little hard, but we're gonna try it. Try it a couple of times. Okay, take a nice deep breath in. Here we go. What a to do to die today at a minute or two to two. Breathe. A thing distinctly hard to say, but hard to still to do. Here we go. For there'll be the tattoo at 20 to 2, a rather tattoo. And the dragon will come when he hears the drum at a minute or two to two today, at a minute or two to two today. Yeah? There we go. So here's what we got. We still got that breath going, right? We still got that quick breath. Yeah, you got that quick breath. So ready? Let's try it again. Let's speed it up just a little bit, okay? Remember, through your nose with your mouth slightly open, you have the going, and also the lower back. And breathe in. And what a to do to die today at a minute or two to two. A thing distinctly hard to say, but harder still to do. For the beat a tattoo at 20 to 2, a rather tattoo. And the dragon will come when he hears the drum, a minute or two to two today at a minute or two to two. Okay? All right? All right, let's try that one more time. And do me a favor, panelists, could we just mute it? Mute you guys, all right? Everyone mute themselves and just try it. Just going to be me, all right? And everyone try it again, just to avoid the confusion, all right? All right, big deep breath. And go. What a to do to die today at a minute or two to two. A thing distinctly hard to say, but harder still to do. For the beat a tattoo at 20 to 2, a rather tattoo, and the dragon will come. Here's the drum at a minute or two to two today at a minute or two to two. Great job. Okay, now we're going to go back to Peter Piper, okay? Actually, let's go back to the whether the weather be hot. Maurice, if we could do that. So that's the other one, more whether the weather be hot, whether the weather be cold, the other one before this. All right, we're going to try another how are we doing on time? We're okay, right? Okay, gotcha. So here's one more, guys. I just want to try this one, all right? So this is a trickier one because it's what. I always had problems with this growing up. So this is something that I tried a lot. Okay. So this is just to get us a little bit of articulation. Let's breathe. Let's walk through it once. Whether the weather be cold, whether the weather be hot, we'll be together, whatever the weather, whether we like it or not. Yeah. Get those jaws going. All right. So and. Whether the weather be cold and whether the weather be hot, boom, we'll be together wherever the weather, whether we like it or not. Great, nice. One more time, a little bit quicker. And whether the weather be cold, whether the weather be hot, we'll be together whatever the weather, whether we like it or not. Okay, great. Now, I want to try one more thing. This is a song that we're going to be doing a little bit later on. I want to introduce it right now, okay? It's called Yellowbird. It's from my father's country of Jamaica, right? We're going to try it a little later on, but I want to teach it to you because I want to get right into it. Now, this song goes, Yellowbird up high in banana tree. Yellowbird, you sit all alone like me. Did your lady friend leave the nest again? That is very sad. Makes me feel so bad. You can fly away in the sky away. You're more lucky than me. Now, I bring this up because later on when we get into rhythms, we're going to be having what your feet are going to do one thing, your hands are going to do another thing, and then you're going to be singing another. So it's going to be a little bit of chew gum and walking and hitting the top of your head type of thing. All right, so that's why I want to introduce this a little bit. Okay, so this song goes like this. You've all probably heard it. Yellow bird up high in banana tree. Boom. Yellow bird, you sit all alone like me. Boom. Did your lady friend leave the nest again? That is very sad, makes me feel so bad. You can fly away in the sky away. You're more lucky than me. I don't know if we're going to go through all of it, but at least you all remember it. Let's try it one more time. And yellow bird up high in banana tree. Here we go. Yellow bird, you sit all alone like me. Here's a funky part. Did your lady friend leave the nest again? That is very sad, makes me feel so bad. You can fly away in the sky away. You're more lucky than me. All right, great. Now, let's try to get a little bit of breath in that, all right? Okay, exhale. Remember our breath. Just bring it in. And yellow bird. Yeah, I just want to try this yellow bird, okay? And breathe in and go. Yellow bird. Okay, now all of it. Yellow bird up high in banana tree. We got the whole phrase. Breathe in. Here we go. Yellow bird up high in banana tree. Here we go. Breathe in. And yellow bird, you sit all alone like me. Yeah. Okay, we're gonna come back to this, and but here comes the syncopated part. And did your lady friend leave? Okay. Now the reason why I brought that up is because we did these quick breaths earlier. This is where all of this comes in. Did your lady friend? Yeah. So it's gonna be a lot of quick breaths. So be ready for that. Actually. So let's try it. Did your lady friend? 5, 6, 7, here we go. And did your lady friend leave the nest again? That is very sad, makes me feel so bad. Let's stop there, yeah? Okay, let's just slow it down. Let's go. So we're going to go, did your lady friend? Take a quick breath, okay? And did your lady friend leave the nest again? That is very sad, makes me feel so bad. Yeah, it's going to be a lot quicker than that, so be ready. You can fly away. Keep going. And you can fly away in the sky away. You're more lucky than me. Yeah? All right, so let's take it up from did your lady friend. Exhale, breathe in. 1, 2, 3. Did your lady friend. And did your lady friend leave the nest again? That is very sad, makes me feel so bad. You can fly away in the sky away. You're more lucky than me. Yeah? Okay. How we doing there? Everybody okay?
Fabulous.
Okay, good. Now since we have a little bit more time, I'm gonna bring something that we did earlier. Bring it back. So I want to try this the breath exercise where we're gonna go 1, 2, 3, 4, 1. The quick one, okay? Just because I want to start speeding that up, just so we can get a lot of breath in a short amount of time. So we're basically going 1, 2, 3, 4, 1. Yeah, we're going to start off slow, and then we're going to keep moving, all right? Dr. Kira, let me know how I'm doing, all right, on time. I can't hear you, sorry.
Yeah.
How we doing, we're okay?
I think, Susan, we might have about maybe a couple more seconds left, and then it's time to move on to the next speaker. Am I wrong? I don't have the timer in front of me.
We'll continue this on your second half, Philip.
What's that?
We'll continue this on your second half.
Sounds good, everybody.
Okay.
All right, we'll keep it moving.
Okay, good. Thank you. That was great.
Okay.
That was amazing.
Okay.
Okay.
Philip's coming back, and we're going to sing this together later.
You may make a singer out of me yet, Philip. All right, so I would like to introduce Dr. Phil Schneider. Dr. Schneider is the founding partner of Schneider Speech Pathology and Professor Emeritus of Communication Disorders at Queens College, City University of New York. He's recognized as a master clinician and teacher, has been in practice for over 50 years. Besides studying voice and speech physiology, Phil's perspective is informed by his own challenge to regain his voice after acquiring Parkinson's disease. Dr. Schneider, we look forward to you talking to us a little bit about the tips that we can use to strengthen our voice and sharpen our speech.
Thank you so much. Just to begin, we're going to be talking about why talk. And I'm going to reiterate the comments of Dr. Kira and ditto Dr. Rizak. We long to belong. When you see
Can
someone,
everybody hear Dr. Snyder? Just speak up a little louder.
I'm going to come closer. Is this
Yeah.
any better? Can you hear me okay now? Hello, hello.
I think so. Yeah. Try that.
All right, when you see someone and you recognize their height and their shape and what their nose looks like, you don't really get to know them. You only get to know them and to feel connected when you have the opportunity and you make the effort to listen to their voice, to their words, to their thoughts and their feelings. And as Dr. Rizak and Dr. Kira pointed out, as human beings, we have many needs. We need food, we need air, we need fluids, but we also have a basic need to feel connected to other people. Parkinson's tends to pull us inward and away from others. When it's hard to be heard and hard to be understood, we can become isolated, we can feel lonely, we can feel diminished. Our job together in the next few minutes will be to learn some simple and effective strategies to strengthen your ability both to be heard and to be understood. The ideas I'm going to share in the next few minutes evolve out of a combination of speech physiology research, of years of clinical experience, and then I've been blessed in the last few years to experience the challenges of Parkinson's disease. And so I now have an inside scoop on some of these ideas that I've been using. But first, I want to caution all of us, myself included, that if anything is helpful to us, we should not think that the battle is over. Parkinson's continues to challenge us, and we need to continue taking care of ourselves and rising above it. We need to use the challenge to grow and perhaps to become better communicators than we were before the Parkinson's challenge. So I'm going to introduce a simple model of speech production. Then I'm going to demonstrate some simple and effective ways to enhance each of the three parts of the speech production system. So how do we produce voice and how do we produce speech? The power supply for speech is the respiratory system. The tone generator, which makes our voice, is the larynx or the vocal folds within the voice. And the ability to shape the distinct vowels that we produce and produce many of the consonants has to do with this upper part of the airway, what we think of the oral cavity or the mouth. So I'm going to take each one of these things, share a little bit about them, and then move into what we can do to strengthen them. So the power supply for speech coming from the respiratory system. The respiratory system is designed to keep us alive by sucking in air, extracting oxygen, getting that oxygen into the bloodstream, which in turn can distribute the oxygen to cells all over our body. The respiratory system then blows out the air, which is now rich with carbon dioxide, to expel those gases. I didn't hear. The steady flow of air coming out of us, the pressurized air that comes out of our lungs for exhalation, that's the power supply that we're going to use to produce our voices and our consonant sounds. The voice is produced by two small flaps of muscle. Hello? The voice is produced by these two flaps of muscle tissue called the vocal folds sitting in the voice box or larynx at the top of the windpipe or trachea. As the air pours out through that part of the airway, those vocal folds are set into oscillation to rapidly open and close at rates something like 100 or a few hundred times per second. Amazing when you think about it. As they open and close rapidly, they change the flow of air from a steady flow to a series of puffs of air. And those puffs of air create a tone. They create acoustic energy known as tone, what we identify as voice. That's produced by the air flowing up through the vocal folds, causing the vocal folds to open and close rapidly. We can adjust the loudness of that voice. We can adjust the pitches from high pitches to low pitches, loud voice to quiet voice. So we have a power supply, the respiratory system. We have a tone generator, the larynx or the vocal folds. And then we have this upper part of the airway called the oral cavity, which shapes the vowels and helps to produce consonants. So I want to take a moment on that. The moving parts of this part of the body, the tongue, the jaw, the lips, the pharynx, the airway toward the back of the oral cavity, together they change the resonance characteristics, the way in which the sound coming from our voice is modulated. So watch how as I change I'll turn on my voice and change the shape of my mouth. So changing these shapes modifies the tone produced in the larynx. And changing these shapes can also produce consonants. We can stop the air completely and explode. Or we can create a small slit in the airway where air can be squeezed through and produce consonants like So we're going to move to the next slide, which is that enhancing any aspect of these three parts of our speech and voice system can also enhance our health. So let me make this point. If we do anything to strengthen our respiratory system, and I'm going to show you some exercises in just a few moments, it's not only going to help make our voice stronger, but it can increase the efficiency of taking in oxygen that we need to survive and expelling carbon dioxide. It can increase our respiratory efficiency. And anything we do to make our vocal fold function stronger, more complete, can help reduce the risk of aspiration pneumonia, because the vocal folds which produce our voice also serve to protect our airway against intrusion of liquids and solids, both at rest and in swallowing. And these vocal folds also help to produce the cough reflex, which protects us by expelling substances that are threatening to enter the airway. When our voice function is really weak, when you meet someone in a hospital and they're barely able to produce a voice, know that their ability to protect their airway is also weak and compromised. So if you can strengthen their voice, you're strengthening their ability to protect their airway as well. And anything we do to improve the muscles which move our mouth, our oral cavity, to produce the different vowels and produce the different consonants can help improve our ability to chew and to swallow. And by the way, reduce drooling. And then one beautiful thing that we often neglect that's so powerful, and we're missing it now, is we wear masks, which is our smile. So if we can strengthen the movements here, we can also regain our smile and bring our smile into the world. And we can also recover our facial expression and show our feelings to others. We're going to move to the slide about ideas to strengthening the breathing. I think it's the next slide. There we go. So the beautiful thing as I share these thoughts right now is they are tried and true. I'm only going to share the things that I have found very helpful for myself. So I'm going to show you the most helpful first. So I have a little device here in my hand. Somebody, I assume you can see this. The item is called M as in Mary, S as in Sam, T as in Thomas, EMST 150. And it's a device designed to strengthen our breathing system. And I'll show you how to use it. So it comes also with a nose clip and an extra white cylinder. You don't need the nose clip or the cylinder. You put the mouthpiece into this blue device, put it up toward your mouth, and turn the outer part of the blue device all the way to the right, all the way clockwise till it won't turn. That is the lightest level of resistance. Then I'm going to take a nice full breath, as Philip was showing us, and I'm going to give a good strong blast through this thing. So here I go. So this is sort of weightlifting for the respiratory system. I'm going to do 5 puffs. So again, inhale nice and deep, strong puff, wait about 10 seconds. You must wait about 10 seconds. Another full breath, strong puff. Do 5 of these. So inhale, puff, wait 10 seconds, inhale, puff, wait 10 seconds. 5 of those, then take a big rest. Do that whole thing 3 times. So 3 sets of 5 puffs, and then do this whole routine 2 or 3 times during the day. I'm going to show it again. Inhale. Inhale. And remember the rest, and remember the inhale. As you get better at this over the next few days and few weeks, you're going to want to add weights to the barbell to make it heavier so your muscles keep lifting more and more. To do that, you turn the end of this device about halfway around to the left, and it'll be harder to blow through it. And you do the same thing. Inhale, puff, rest, inhale, puff, rest. Here I go. This is a very powerful, whoa, I'm surprised by feeling my voice stronger. This is a great tool. It not only will increase the strength of your breathing for your voice, can it help your breathing in general, and it may also help reduce drooling and swallowing issues and make your articulation stronger. Moving to the voice generator. A couple of things you can do for your voice. Number one, the number one thing, which is the easiest with the biggest return for all of us, is sipping water. I don't mean drinking water, I literally mean sipping frequent teaspoon worth of water. And I'm telling you, but I'm really talking to myself and letting you listen. Frequent sips, never speaking without it, whether I'm wherever I am, I need water. Take small sips so I don't tank up too fast. Clear fluid is the best. Things that are sweet or have milk substances in it create thickened mucus, so they're not the best. Clear fluid, any temperature that you like. This can reduce vocal fatigue, can enhance your loudness, can reduce hoarseness and breathiness. Good thing for you. People often ask me, how does this work? Because the water is not going directly on your vocal folds, or you'd wind up coughing immediately. But when you swallow, if you put your finger on the Adam's apple, the little bump in your neck, when you swallow, if you can see, the bump goes up and then it comes back down. The whole larynx rises up in the neck and then comes back down. And when that happens, you get two benefits from that. When it rises up, it squeezes the glands above it. They secrete a little lubricant onto the vocal folds, and the vocal folds close completely, spreading out that liquid across them, giving them sort of a creaming, making their surface more elastic. And so you get a relaxation of the muscles of the whole larynx, and you get a lubrication effect on the vocal folds. So swallowing relaxes and lubricates the vocal folds mechanism. Very powerful.
Dr. Schneider, can you just relay the name of the device that you were using before?
Yes, it goes by a set of letters. E as in elephant, M as in Mary, S as in Saturday, T as in Thomas, 150. It costs about $50. It's worth thousands of dollars. I won't tell them that, but it's been a godsend for me.
Dr. Schneider, one more question that somebody put up here is that device the same as the breather, which is similar? I see, I'm more familiar with the breather, but it's similar to what you have there. You can adjust the settings. It does have different mouthpieces and different things that you can click on. I think the breather on the website, I don't know if EMST does, but they also have accompanying videos that the person can walk through and do exercises with.
Yeah, most of the companies that make these kinds of devices have video clips on their websites. This one does as well. I've tried a couple of them. I'm not saying this is, and anyone that you're going to use is the one that's going to work. The one you don't use is not going to work. So basically you're creating a resistance, and frankly, you can do it without a device. If you can create the resistance to the airflow with your mouth like this, you can breathe, and you can vary the resistance of your lips while the wind is coming through, with or without voice. Device helps, but there are other ways to go. So the sipping, in the singing world, they say sing wet and pee clear. And in our world where our voice might be compromised, I know I cannot get through my workday without stopping to sip. As I said, water-like substances are the best. I have one more set of exercise to make the voice actually stronger. And this is an exercise that was used by actors in the Elizabethan day to strengthen their voices, and it's been used. Yes, you have a question?
I wanted to just ask you, because we have somebody in the chat posed a question. How do you know when to increase the resistance or the weights the person is asking on that device? Would that be something on the company website? Is that something that you would feel as you're moving through?
Well, certainly noticing yourself and becoming aware, as Dr. Rizak pointed out, awareness is the greatest tool for change and growth. So if you feel that you're getting through your 3 sets of 5 puffs and you got plenty of juice left in your tank, you're not lifting enough weight. You want to make it hard enough that by the time you get done with your last set of the third set of 5 puffs, you're beat. So keep working it till you can't do it. If you can't get through 3 sets of 5, make it easier. Now, some days you wake up and you just don't have the energy you had yesterday, so you're going to have to ease it up. And some days you feel like super person, and so you're going to tighten it up. You're going to increase. So you increase it and decrease the resistance based on your needs and your ability to go through the 3 sets of 5. Is that helpful? I want to introduce one other exercise that's really, for many people, quite magical. I call it bubble hum, not to be confused with bubble gum. What I'm going to do, and you need a glass of water and a straw. And basically you're going to blow bubbles. So you take a breath of air. I always start with a sip of water. Sip, fill up my gas tank with air, blow bubbles. I want to keep the stream of bubbles even and with low effort, not too much tension, not too much force. That's half the exercise. To really get the full effect, I need to add one element to this. So this time I'm going to sip the water, fill my tank with air, blow the bubbles, and add humming. We'll see if we can hear this. Here's the sip. Here's the breath of air. Could you hear that? Did the voice come through there, the hum? Yes, no? Could you hear the hum? I'll do it one more time. A little tremor to show you that I've got the tremor going. Sip. Fill the air. Bubbles. Here's without the bubbles, and then I'll add it. I'll turn the voice on and off with the hum. As that gets easier, make your hum louder. As it continues to get easier, play around with the pitch. Sip. Inhale. So we make the pitch go from low to high and make the pitch go from high to low. I don't know if you can hear my voice getting clearer and stronger, but I feel it is. And if you want to have fun with this, once you get a little, this can take a few days to get easier for you. You can add melody. And as Philip was showing us, music is magic, brings up the spirit. So I'll do a little one, see if you can figure out what melody this is. Take a sip, fill the gas tank. Sip again. Fill the gas tank. So that's the bubble hum. I suggest you spend a minute or two on that 3 times a day and enjoy yourself. So we've dealt with the respiratory system for the power supply. We've dealt with the generator of tone or voice in the larynx. Now we're going to deal with the top part of the airway, the upper airway, the oral cavity and the adjustments of it, and talk about what can we do to make this stronger or sharper. Because very often what happens here is it becomes slow and weak, imprecise, sometimes rapid to the point where our car is going faster than with a loose steering wheel. And how are we going to make this sharper so the sounds are better defined and our intelligibility, people's ability to understand what it is we're saying, becomes enhanced instead of compromised. Another thing that often happens that was referred to by the doctors in the beginning was that sometimes there is a kind of inner drive, an urge, an uncontrollable urge from the Parkinson's to move faster and faster and faster like a stone rolling down a mountain. And sometimes we also develop a tendency to have a stutter-like disfluency. So this strategy I'm going to show you will help clarify your vowels and your consonants, reduce the rapid movements, and reduce the disfluency. So it can be powerful. It's not easy, takes training and takes maintenance. So here we go. It's called a fancy technical word, pausing or stopping frequently, and really taking it to an extreme. So speak one word or two or three or four, but not 5 or 6 or 7. So I'll show you a normal rapid rate of speech. This morning I had a wonderful opportunity to get out while it's really cold and the sky was blue, and I took a walk with a friend in the woods, and I really felt elevated by the whole experience. This morning, I took a wonderful walk in a beautiful wooded area with a lovely friend, and we talked about everything that was important in our lives. So that's pausing. Now, that it is not easy to do. It's not normal. It's extraordinary. It's out of the ordinary. It not only can compensate and resist these things in the Parkinson's, which can smush up your vowels and your consonants, make them imprecise, but it can make you more precise in every possible way, including you'll find your language gets sharper, your choice of words gets better as you have more time for word retrieval. And again, it requires that you tune in to what you're doing, and you need to practice it as a skill that requires training on a regular basis. There's one more piece here to getting more clarity into the speech, and it can be practiced and trained. Take a few, write down a phrase or two, like a 3 or 4 or 5 sentence word. So I'll write down, let's see, I wrote a few so I would remember. I love chocolate ice cream. So the phrase could be, I love chocolate ice cream. Or it could be, I love chocolate ice cream. Or I love chocolate ice cream. Or I love chocolate ice cream. So you can practice the phrase, emphasizing different words in it. And you don't just do it by barking. You do it by thinking about what that word means to you. The word I, what does I mean to you? And if you speak with that kind of intention that every word you have to say has a world of meaning in it, and you take the time to think about that, your messages will become sharper and stronger and profound. I love chocolate ice cream. I love chocolate. Try to say chocolate in such a way that people can taste it. Ice cream. I hope, Dr. Rizak, you're listening, because I've heard you talk about ice cream a few times. So you can practice pausing, and then you can take the same thing and begin to add seasoning to the words, so that different words have the emphasis in what you're saying, as opposed to, I love chocolate ice cream. And again, the Parkinson's draws our movements to be smaller and less precise and less sharp. We can fight it by doing the opposite of what the Parkinson's wants to pull us in, soften our voice. We can practice using stronger voice. And the issue of perception, which Dr. Rizak spoke about, is so fascinating to me. And it exists in my own life that when I speak to my wife or other people, I often feel like I'm loud enough. And then if I feel, and I get the I can't hear you, and I used to be accustomed to having a very strong, loud voice, I'm startled. And then if I get loud enough, people say I can hear you, I feel like I'm screaming. So there's something in my perception that's been thrown off. I needed to sit there because I started to notice my voice was becoming more compromised. So there are things we can do. We can fight this story effectively, and so effectively we might even become better than we were before we started the battle. We can make a big difference. We can increase our ability to connect with others. And if we do this, we're going to feel like connecting more, and we are going to connect more. We can regain stuff that we've lost, and we can maintain what we've increased. So my wish for all of us is that not that we have good luck, but that we have good work overcoming the challenge, what I call the PD challenge, and becoming better communicators and better people because of it. Thanks for the opportunity.
Thank you so much, Dr. Schneider. That was wonderful, very informative. I do want to point out, as some people have noticed already, that we are running just a little bit over, maybe about 10, 15 minutes over. We really hope that you'll stay for the rest of our program. We have some wonderful exercises coming up again with Philip Hamilton, and then we'll have a question and answer session, a panel discussion, where we will all be here to answer your questions. I also encourage you, as many of you have already, to use the bottom options on your screen screen. You can type any questions in the chat or in the Q&A button. Dr. Schneider, I think you have a question actually in the Q&A section. If you want to go ahead and answer that, I'll let you take care of that question. And in the meantime, I will go back to Philip Hamilton so that he can take us through some songs using all the skills that we've learned today.
That's right. How you doing, everybody? Okay, so we're going to continue on with what we were talking about earlier. I'm going to keep put on this metronome. I'm actually going to put it here so everybody can hear it. Here how it goes. 1, 2, 3. I just want you to feel this pace. So, okay, this pulse. 2, 3, 4. Yeah, one more time. 1, 2, 3. Now I want you to, as we're sitting down, just kind of sway. 1, 2, 3, 4. 1 and 3. 1, yeah, just kind of sway. 3, 4. Get it in your body. 1, 2, 3, 4. We're slowing it down, right? 1, 2, 3. Now we're gonna breathe in. Remember, through your nose with your mouth wide open. 2, 3, 4. Let it go. 1. Yeah, this is the pace we're at. We're gonna calm it down. 4. Breathe in. 1, 2, 3. Yeah. 4. Let it go. 1, 2, 3. Now we're gonna use our breath. We're gonna go 1, 2. Yeah. 3, 4. Let it go. 1, 2. Now we're about to start a phrase. Check this out. We're gonna go 1. Breathe in. 2, 3. Here's the phrase. It goes, how are you? I'm fine. How are you? Quick breath. I'm fine. How are you? Quick breath. I'm fine. How are you? I'm fine. Okay, just listen. 1, 2, breathe in. 3, 4, let it go. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4. Last time. 1, 2. This is about we all have rhythm. Let's sing together, right? Yeah. 2, 3, 4. Let it go. 1. All right. 2. We're gonna breathe in. I don't know where we are, but I think we're on breathing in. Yeah. 2, 3. How are you? And slow. How are you? I'm fine. How are you? Hear how slow it is? I'm fine. How this is called the clave in Latin music. I'm fine. How this is 3-2 clave. 2. I'm fine. So it's basically 1, 2, 3, 1, 2. 1, 2, 3, 1, 2. So we go. How are you? I'm fine. How are you? Can you hear that clave still? I'm fine. How are you? I'm fine. How are you? Now we're going to clap it. Try that. And how are you? I'm fine. 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 Now the tricky part we all know is how are you? Boom, yeah. How are you? And then we wait for the beat. So check this out. Watch me for a minute. How are you? I'm fine, right? How are you? Yeah, so we gotta wait for that beat. Once again, 5, 6. How are you? And how? Clap it with me. You? I'm fine. How are you? Remember, that's the swear. I'm fine. How are you? I'm fine. How are you? Yeah, keep going. I'm fine. Breathe in. How are you? I'm fine. How are you? I'm fine. Now back to the sway. 1, 2, 3. Yeah. 4. This is still the underlying pulse, right? 2, 3, 4, right? 1, 2, you feel it? 3, 4, 1. Last one, 2. Back to how are you? We're gonna clap it and sing it. And how are you? I'm fine. Listen, how are you? I'm fine, right? How are you? I'm fine, right? How are you? I'm fine. Now check this out. Yellow bird up high in banana tree, right? Yellow bird, you sit all alone like me. Don't worry about the words, I got this. Yellow bird, up high in banana tree. Yellow bird, yeah. You sit all alone like me. Let's just get that happening. All right. How are you? Yeah, remember that. I'm fine. Still there, right? How are you? I'm fine, right? How are you? I'm fine, right? The sway helps. You'll be surprised. Boom, back to yellow bird and yellow bird up high in banana tree. Yellow bird, you sit all alone like me. Back to how are you? How are you? I'm fine. How are, last one, I'm fine. Now I'm going to speed it up just a little bit, okay? Because we've done so well, all right? Now let's bring it up just a little bit, up to 70, right? So it's going to be there. 1, 2, 3, 4. Remember again, 1, 3. There's our sway. 1, 3. How are you? I'm fine, right? How are you, right? I'm fine. How are you? I'm going to put the metronome over here. How are you? We're going to clap if I'm fine. And how are you? I'm fine. How are you? I'm fine. Got the rhythm now, right? You, yeah? I'm fine. Swings a little bit better, right? You? I'm fine. One more time. How are you? I'm fine. You gotta wait there, right? You? I'm fine, right? How are you? I'm fine. Here comes yellow bird. You? Here we go. Yellow bird up high in banana tree. Yellow bird, you sit all alone like me. Yellow bird again. Yellow bird, up high in banana tree. Boom, boom. Yellow bird, you sit all alone like me. Now I'm gonna break it up, yeah? Did your lady friend leave the nest again? That is very sad. Makes me feel so sad, right? That's gonna be tricky, right? So let's see if we can stop it for a second so we don't get confused. All right, let's try this. All right.
And Philip, if I could just say before your last thing, I think right after this exercise, we may need to bring it to Q&A quickly before
No
everybody
problem,
has
no
to-
problem. All right, so
Thank you.
let's speed it up just a little bit one more time, and we won't. Let's do the verse next time. All right. So let's stick on yellow bird. All right. 1, 2. Thanks a lot. 1, 2, 3. How are you? And how are you? I'm fine. How are you? I'm fine. How are you? I'm fine, right? How are you? Yellow bird, here we go. Yellow bird, up high in banana tree. Yellow bird, you sit all alone like me. Yellow bird, one more time. Yellow bird, up high in banana tree. Yellow bird, you sit all alone. Here we go. Me, boom, boom. Thanks a lot. That's good. All right, Dr. Kira, back to you. Great job, everybody.
Thank you so much, Philip. That was definitely a good exercise for all of us. So I want to thank all the panelists for all of their very comprehensive and instructive exercises and information that they gave us today. Now is really a chance for us to get a chance to ask the panelists any information that you might have. I have some for us to just start with, just some common questions that we can begin to address. One actually comes from an audience member, and the question, I guess, would be for you, Dr. Schneider, and potentially you, you, Philip, in what is the role of intent in speech or in voice? And I mean, I'm just going to start by saying I think it's very important, but I'll let you guys answer.
Well, maybe I'll answer by repeating the question. What is the role of intention in our speech? So I'm not sure what the person asking the question had in mind. And sometimes people have very special thoughts about, and Dr. Vecchetti mentioned, when you use a word, it may mean one thing to one person, but to me, it would mean I am really inside of the word, thinking about its meaning to me at that moment.
And if I could just elaborate on what you said, Dr. Schneider, there's a saying that we have, right? It's not what you say, it's how you said it.
Yeah.
And Philip, do you have anything to add to that?
No, it's the same with singing. It's your intention. I find a lot of times that when when I'm working with students, that we need to sit back and look at the words. And when we have the intention behind the word, I notice that the song just comes out a lot more fuller, or with clarity, or with intention. So intent is very important in singing.
Very nice. Thank you. To get to some of the other questions that we have, Dr. Rizak and Dr. Fricchetti, maybe you guys would want to speak a little bit to this. One common question that our patients oftentimes come in with is, my voice is getting hoarse, it's getting lower. Does this mean that it's Parkinson's?
So maybe I'll just start. So I mean, low voice volume, I really associate together with Parkinson's disease, and I also try to ask if that person's voice improves by taking the Parkinson's medication, especially with the stronger ones like carbidopa, levodopa, because then we can establish that this is a symptom that responds to dopamine, and especially if it does that. I do align it with Parkinson's disease. What we didn't mention is that sometimes symptoms of Parkinson's can vary. I mean, I think Phil kind of mentioned it, that, for example, with that device that you place in the mouth, that on some days you put the resistance stronger, some days you put it less. So there's some variability. And if it correlates with the other Parkinson's symptoms, that's what I would call it. Also, when people talk during sleep, sometimes the speech during REM behavior disorder actually might be louder, and that's also another avenue of research. So if it has this variability, I would clearly connect it to Parkinson's. Now, hoarseness of speech may be connected to the disease, but as we know, hoarseness comes from the recurrent laryngeal nerve. We're learning more and more about how that may be damaged. I often work together with Dr. Craig Zalvan, who's an ENT specialist, who believes that there might be some people with laryngeal nerve damage from unknown reasons. Sometimes, he has a theory that sometimes even viruses can affect it. And, now, for example, in today's day and age, when, for example, coronavirus is around and people get facial droops as a result of corona, it may not be that far-fetched to think that it might affect the recurrent laryngeal nerve as well. But, that's individual, and we often have to take a look at other things like, well, could something like a thyroid mass be compressing that nerve? But let me see if Dr. Rizak has, any other suggestions, but that's sort of how I approach it.
And Dr. Rizak, while you're answering that, if I can just add for something else to you to answer as well, do you think that hearing tests would be important in all of this?
Okay, I'll do the hearing part first. Absolutely, 120%, because actually there's new data out that is demonstrating that a very large percentage of Parkinson patients have hearing loss early on, and it's actually being considered to be included in the one of the non-motor features of Parkinson's disease. How that all fits in exactly, I think we need more research, but it's so common, and it can obviously, as we discussed today, influence your speech and your volume. That feedback is very important. So I think it's critical, and I'm starting to think that at least once a year, our patients with Parkinson's should, I'm sure the audiologists are going to be thrilled, but then once a year, I think we should actually get a hearing test on our patients. And it actually has been shown to occur even sometimes well before the first motor symptoms, so it could be a premotor symptom. But the other part of the question is, I think, we make an assumption that, it fits Parkinson's. It looks like Parkinson's, smells like it's got to be Parkinson's, but there are people that end up with nodules on their vocal cords. As Dr. Facchetti said, it could be a thyroid mass, could be a lot of other things. So I think just, we need a good ENT doctor involved sometimes to take a look down there with a scope, and it's not really painful. They don't go down very deep, but to just look at the vocal cords, how bowed are they, which is common in Parkinson's? Is there a little growth on there, just to rule it out? So I think we can't just make the assumption that that this is Parkinson's, although we do a lot of that. I think we have to think about other things.
Yeah, and let's not forget there are other chronic neurologic conditions that experience similar kind of symptoms. So patients with MS, for example, will have voice hoarseness and hypophonia, which we call low voice volume. So, but it's a good question. Dr. Schneider, one of the questions potentially you could enlighten us on was, if my voice has been weak and my speech unclear for a long time, is it still possible to make any significant improvement?
Yes. And I'll give a little further explanation. Yes. One of the interesting things about Parkinson's is you've never lost the ability to get back in the fight. Sometimes you need somebody to fire you up and inspire you. My response to losing my voice and closing my practice a few years ago was to just become depressed. And then I had to hire somebody who had been one of my students. I said, I'm paying you, even though I had taught you all this stuff, so I have to force myself to work because I can't sit down with you every week and not work. And I could have just assumed it was gone forever. So this is true of many of the physical aspects of Parkinson's. If you work it, you can increase your function, and nobody knows how much. And if you stop working, you slide back down. So always possible.
Thank you.
And also, let me say something quickly.
Sure.
I've just been hearing from students that these type of exercises, like the Peter Piper and just vocal articulations has helped folks to strengthen their voice and strengthen obviously their articulations. So yeah, something to think about.
Thank you, Philip.
Yeah.
And while we're on you, can we ask you to talk to us a little bit about where does the power come from when you sing? And in particular, would singing be a great way to exercise some of these different symptoms that we're experiencing?
Yeah. Well, I could just talk from personal experience. That's why I do the ho, ho, ho. This is the chi. This is the diaphragm. This is where everything is coming from. Ho, ho, ho. So this is when this is where the power comes in. When I'm singing this, I'm focusing on this part of the breathing apparatus, the breathing system. Like if you check this out, ho ha 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 hey 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 ho 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 ha hey. It's all coming from here. So everyone keeps thinking. What's that? Yeah, everyone keeps thinking it comes from the chest or all this, but that's why I keep talking to folks about bringing air back to the lower back, bringing air to below the belly button. There's all this space here that we can use to speak to utilize the breath. So yeah, singing is very important. And what I also see that singing with other people, I mean, just to see the joy on people's faces, like I mentioned earlier about happy birthday, look around the room when people singing happy, there's this feeling in the room. But I mean, you can imagine like a room full of folks sitting around singing Frank Sinatra songs or Nat King Cole songs, or, there's just this feeling in the air that, everyone gets energized by everybody else, which is why COVID is kind of obvious, like everybody taking it away from us, but we're doing the best we can,
Thank you. Another question, and I'll leave this up to any of the panelists who wants to chime in. If you have speaking problems, is there a correlation to swallowing or dysphagia, as we call it? And are there any exercises, this is a question directly from an attendee, that would help to minimize choking in particular? Anybody want to take a
I think
stab
Phil
at that?
should take that one.
So as I shared a little bit in the presentation, that weakness in the vocal folds and weakness in the muscles in the pharynx, the back of the oral cavity, lead people to have trouble protecting their airway when they're swallowing and when they have liquids in there that they're ingesting, or even your own secretions. So if you hear a weak voice, it's likely to represent weakness in the ability to move food safely into your foodway and not your airway. So anything you do to strengthen your voice can help your swallowing. And then there's some I'll give you quickly just 1 or 2 tips about swallowing. If your chin is tucked when you swallow, so you have to be more conscious with the swallowing, you have to do your chewing really well. And then know before you swallow that you're going to swallow. Instead of automatically, do it consciously. If you bring your chin down, the airway is like a garden hose. If it's straight, it's wide open. If you bend it, it gets pinched. So when you tuck your chin down, you're guarding your airway without using muscle, passively guarding. So you will swallow more. You can swallow more thinner materials like water more safely with a chin tuck. And then of course, there are things to be learned about making sure the consistency is right for you and you don't mix consistencies, liquid and solids at the same time.
Very good, thank you. Anybody else want to talk about the connection between this, the speaking and the swallowing?
Well, I'll just mention that as I in my talk, I mean, it's clearly the people who really do well with exercise, with the therapy, will have some overlap with an improvement in swallowing, and it's reflected in brain structure activity as seen in a PET scan, the deoxyglucose PET scans and other things. So there is an overlap. I mean, these are the same kind of muscles and same neural connections that control both, and they have to really be coordinated very well. So when we swallow or we speak or we swallow, the airway gets protected. So things do not go down the trachea, and it's very highly coordinated activity. And I mean, it's been shown that good speech therapy by Dr. Phil, and others can really make a big difference.
Thank you, Dr. Rezac. Dr. Fichetti, you look like you.
Yeah, so I mean, I'll just say I'll agree with that there's a correlation, and like how Dr. Rezac said that we're using the same neurological structures. I was looking at the typed questions, and then someone here put a typed question: is the amount of sort of like medication that somebody's used related? So I just wanted to make a comment that sometimes there are patients who sort of have more advanced disease, so the fluctuations are larger. They have to use higher dosages of medications just in general. So the higher dosages may make them have higher sort of peaks of blood level of the medication. And I've seen some more of that rapid speech at those peaks. But as Phil has said, if that's happening, patients can involve that pausing method to try to break up that rapid speech.
Very nice, thank you. So I think we're going to stop here because we've gone significantly over time. I'm not sure what everybody is doing during COVID anyway, but why not stop here, let everybody kind of consolidate all the information that they heard. Hopefully you guys have found it really helpful. You're going to see a poll pop up on your screen. Please complete the poll. It really helps us understand what was helpful, what you enjoyed about the seminars, where you'd like future seminars to go. So please go ahead and complete that if you can. While you're completing that, I'm just going to end with saying thank you to all of our panelists. Thank you so much to Parkinson's Wellness Project too for putting all of this together. This is my second time that I have had the honor of participating, and it's been wonderful to get to speak with colleagues and get to add something in the lives of all the attendees that are here today. So thank you so much. And Susan, with that, I'll let you have the final thoughts.
Thank you, everybody. I think this was really informative, interesting meetings, and you're already getting feedback from us. And I think a lot of people are it's hard not to be with everybody. It's hard not to see everybody. But at least we can do it this way. I want to also say that February 2nd is, can you hear me? Oh,
There's music going over, so it's a little hard to hear you.
turn off the music. On February 2nd, Synovian will be giving a talk on their medication with Dr. Stilben, and that's in the evening, 6:30 Tuesday. On February 7th, we have our next webinar. It's Music as Medicine. So I hope you'll all join us. And I'm sorry for the lateness today. One more thing. We do have an exercise program, and we do have fantastic teachers. And it's all over Zoom. So just check out our website, parkinsonswellnessproject.org. Call me if you want to join, or just join online, and we would love you to be in our classes. You see how important it is. Also, I want to say one more thing about all our panelists. When we bring our panelists, our professionals, our teachers on, I want you to know that they're all reachable, they're all accessible, and they're all here to help all of you. So thank you again, everybody. I appreciate all your wonderful information. And
Thank you so much.
Okay.
And go Green Bay.
I hope everybody has a good rest of the weekend. Enjoy the rest of your Sunday.
Thank you. Thank you,
Take
Dr.
care.
Bye.
Bye, everybody.
It's been a pleasure, everybody.
Thank you,
Thank
Philip.
you.
Thank you
Bye-bye.
so much.
Bye.
Thank you, Dr. Rizak. Thank you, Dr. Fratetti.
Thank you.
Reach inside your
Filling out the
mind,
pool, everybody.
find the dream you thought about for a long, long time. Climb the mountain that you always said you could, the one you always said you would. Reach inside your pocket, find the change you said that you always make. Take the chances that you've been afraid to take. Fear will be your worst mistake. Don't turn back now. Don't turn back now. Dreams are there for the making. Don't turn back now. Don't turn back now. Stars are there for the taking. If you can see through the